Hello everyone, this is Dr. Carlos Rainha, and I'm from the Smart Slim Clinic, and we're here again to speak about some subject here. And you know, the beauty matters, and so the one we're gonna pick it up today is gonna be about the rhinoplasty. And so the rhinoplasty is part of your nose, right? And let's go start from saying your nose, there is a structure, right? And they really matter in your face, because when you look people in the face, one of the things is stand up, you know, we'll consider everything else on your face, but obviously we're going to talk about the nose. And there is a structure, you know, there, which is part of is a bone, the other one is a cartilage. And that construction of your face, there's a blanket over that structure, that's your skin, right? So don't blame the skin there. If you have a nose which does not fit, you know, it's not nice when you look on your mirror, and people might make some comment, or you make some comment to yourself. That is because not the blanket with your skin, but because the structure there, right? So it's same thing. You have your bed, and then you have some fold things under, and you throw the blanket. That's gonna show that little fold, you know, when you have a blanket over, right? Let's go quickly here. I'm gonna just show you, you know, a very simple anatomy, because we're not going here through anatomy, right? It shows your bone there, and it shows you upper cartilage and lower cartilage in your skin, right? And then here you see something more structure, right? And what we're gonna focus to change someone's nose, and it's gonna be, we're looking especially for your septal cartilage, right? So you're gonna look right here, you know, and between this lateral, you know, crust that we call, or, you know, those cartilage, which that make the difference, you know, when you're gonna lift your nose. But a lot of people think that's the only thing we touch, right? So we have a surgery which is closed. It's a closed surgery. Another one is open surgery. You know, when the people come to us, we need to see if you're a good candidate for a surgery, right? It's not just like, hey, doctor, I want my nose to kind of go a little higher here, and everybody has different kind of nose, right? But just for this moment here in this picture, you're gonna see the septum here and the septum right there between. If your septum is deviated for some reason, now we need to do an open surgery to fix your septum, right? And so your nose, you know, after surgery, it don't continue in the same direction. So here there's some angles, right? Well, you know, everybody approach this a little bit different, but there's some of the angles there we need to respect it. And that it comes from your forehead, it comes from your nose, your lips, your chin. So those angles there, that will make us to see where we're gonna fix it. Sometimes people think, is my nose the problem? Well, guess what, you know? So you're gonna see here, the chin sometimes is your problem, because we need to sometimes, you know, add it, you know, or do some implant. When I say implant, it's not prosthesis, it's your own fat tissue, we can do that. And add it, something to your chin. And once we add it to that, so we'll fix that angle, you know, and create a more harmony and a more matching, you know, face. So when you look at, especially on the perfume, all right. So let's go look at another one here. So let's just example this. A girl here has, you know, the little and down, you know, there. So what do we do with that one? You know, we need to go in, eliminate cartilage is going down. We need to be lifted here, and you have the bone there, what you need to be, you know, pretty much take out. So we'll follow that, right? So let's go for another here. You see some angle there, you know, and don't go be so crazy on those angles, because this is just an example, right? Sometimes you can't meet that. Some people never will be able to bring it to that position. But you see some, you know, go down here, And so you see the nasal frontal, nasal facial, nasal labial, and all that we need to consider. And not forget about your chin here, because sometimes you see if you have your forehead going in that direction and or too much there, so it changes all these angles again. So that's just give you idea how we need to approach, right? Here is your some example, before, after, before and after. There is again some the position you have, the septal cartilage, lower nasal cartilage there, but it doesn't show this picture, but there is a septum there also. But here again, folks, we need to approach this individually. You're more than welcome to call us, and we can clarify some questions. If you have any questions, you're more go to my website. Smart Slim, and so we can have a contact with you, and so we'll be more glad to clarify questions in the future soon. We'll see you soon for the next video.